You don't have vertigo. You feel vertigo. Vertigo is the symptom of when you have a problem. What can we do to get rid of the dizziness? Hey, you guys. Welcome to Neuroathletic PT. This is Dr. Jonny Crowder here today. And for today's video, we're going to be talking about why you feel dizzy and why no one has explained it clearly. And so when it comes to dizziness, the most common word that we use is vertigo. But I have to be really clear on something. You don't have vertigo. You feel vertigo. And there's a big difference there. Because vertigo by itself, it's not really your diagnosis. Vertigo, if we use the real definition, it's that you feel like you or the room are spinning is what you have. Now, when it comes to what causes vertigo, there's 100 causes of vertigo out there. But most of the time, people are often talking about a specific one type of vertigo. In the same way that when you go to your doctor and you say, I have pain, the doctor doesn't say, okay, diagnosis, pain, pill for pain, done. You'd feel like you got terrible care for that. You'd think, you don't want to know why I have pain? This pain is the symptom that says I have a problem. In the same way that vertigo is the symptom of when you have a problem. Most people don't just want a pill to make their symptom go away. They want to fix the why you have the symptom in the first place. And so when it comes to understanding why you feel dizzy or why you have vertigo, we have to understand the 3 different sensory systems and how each one has a really important role in making sure that you don't feel dizzy. And so often people ask me things like, how come the doctor didn't look in my ear and find out why I have inner ear dizziness? Reasonable question. But the reality is, when the doctor looks in your ear, they see your eardrum, and they see, is there fluid in there? The actual apparatus is on the other side of the eardrum that the doctor can't see. Even when they do an MRI, the MRI is not going to find anything because the MRI doesn't actually look at the inside of the vestibular apparatus, which is the part that controls, do you have that traditional vertigo or not? And so when it comes to explaining why you might be dizzy and why you might have vertigo, we have to think we have our vision that contributes to do you feel dizzy? And so you have to think about things like, do you have a diagnosis that's impacted your vision? Glaucoma, macular degeneration. Your eyes are just getting a little bit worse and now you're wearing bifocals. All of those change what your vision sees and your depth perception. And so that can make you feel dizzy. You have your inner ear, the vestibular apparatus. You have diagnoses like, when people say my crystals are loose, where they're talking about BPPV, also known as benign paroxysmal positional vertigo. And there's tons of other vestibular diagnoses that can be causing your dizziness that impact how the inner ear sends its balance signals to the brain. And then your body has the somatosensory system. That's going to be your skin, your muscles, your joints, how everything together sends all the signals to your brain to let you know, am I standing? Am I sitting? Am I standing on a hill? Am I sideways? And so it lets your body have a perception of where you are in space. If you close your eyes and turn your head to the left and leave it there, your brain knows my head's turned to the left. It's because signals from your neck muscles are saying, this muscle's working, this muscle's stretching, so my head is turned. And so the somatosensory system also works to help you understand where you are in space so that you don't feel dizzy. And so the most common cause of somatosensory issues, neuropathy. That's going to be the big one that makes people feel dizzy because you can't feel where you are. And so it takes all 3 systems working together effectively to have you not really feel dizzy at all and to feel normal. Often, if 2 systems are working really, really well, you don't feel so dizzy. But when you start to have multiple systems not working well, or one that's working really poorly, you start to get a sense of dizziness. And so dizziness can look like anything from full-blown vertigo, where maybe every time you lay down, the rim spins for 10 to 60 seconds, or it might feel like every time I stand up on my feet, I get a little bit lightheaded and off balance. It could be neuropathy, or you could be having blood pressure changes that could be impacting it. It could be things like, when I move too quick, my whole world blurs and I can't see anything. I get a wave of dizziness that passes over me. Another term I get often is woozy feeling, but it's just that wave of dizziness that comes through. And so there's many different things that could be causing your specific dizziness. And that what we're going to look at over the next many videos is what are all the causes of what could be causing the dizziness that I have? And then, more importantly, what can we do to get rid of the dizziness? Because that's what we all want at the end of the day. We want to not feel dizzy and be able to just go live, not have to feel like we're in a world that I'm afraid to move too fast. I don't want to roll to my left side and live in a world of I can't, I don't want, and to restrict what you do. Rather, we want everything to get better so that you can live your full normal life. If you want to do it, go do it and not have to be fearful about what it's going to feel like. Am I going to get dizzy? Am I going to fall over? And so if you're interested in videos like that, please like and subscribe to this one, but then follow me for all the other future videos, because that's where we're going to look specifically at what's causing your dizziness. Thank you for watching, and I hope you like it.